I'm Dr. John Q. Cook, director of the Whole Beauty Institute in Chicago and Winnetka, Illinois. And we're going to take a couple minutes to talk about breast implants and the different choices that exist. You know, it's wonderful because there is a much broader range of choices for women who are considering breast implant surgery than was the case a number of years ago. The 4 implants you see here are all silicone gel implants. These remain the most popular implants in our practice, and I think the reason for that is that most people feel that they have the most natural feel. It's important to note that when a patient comes in and looks at implants, sometimes if you look at them just when they're sitting on a tabletop, you think, well, that's not going to look very good. But actually, remember, in the body, it's a different thing because there's the interaction between the natural structure of the body and the implant. So they're going to have typically more of a teardrop shape, which is often what we want in terms of naturalness. That said, there can be different variables that we can control with implants now. One is projection. In general, for the same amount of gel, if your base is smaller, it goes forward. So for a woman who wants to have a little more fullness, particularly in the upper portion of the breast, she might choose a higher profile implant because that is going to tend to give a greater degree of fullness in the upper portion of the breast than an implant that has a lower profile. And the other thing is the degree of cohesivity. That's something that the camera isn't going to really pick up, but it's a difference in the feel of the implant. So the more cohesive implant's going to be a firmer implant. It's going to, in some ways, have a more distinct shape, but on the other hand, for some patients, it may feel too firm. And these are important things to discuss with your surgeon. Now, there's some patients who really prefer saline implants. And as the name suggests, it's the same thing. It's a shell, but it's filled with salt water. Now, a couple of nice things about saline. Number one, you can typically put them in through a smaller incision because they come without the fill, and so you put them in and fill them with sterile saline, so you can introduce them through a small incision. There's also a little bit of adjustability because you're, as the surgeon, controlling the amount of volume in there, and that can sometimes have advantages. The trade-off is it's not quite as natural a feel as the gel. The more you have of your own natural structure, maybe the less an issue that is. This is an interesting possibility, the so-called ideal implant, also saline, but it has an interesting double chamber construction and has a little bit more of the feel of the silicone gel implants. Finally, we should never forget using your own natural tissue for just the right person. You know, sometimes we can do fat transfer to enhance a breast. I personally feel that that works the best in patients who maybe are going up a cup size or fine-tuning the shape of the breast. I think it can be very good there. But the great thing is to have a whole range of choices because then we're really coming the closest to having a meeting of the minds with our patients.